welcome to not another episode of the podcast, because this is not the podcast. So what this is it's a brand new format that we have invented called the Shortcast. Okay. So as you know, the podcast is really about helping NGOs by talking to different donors, different CSRs, and understanding what exactly is the work that they want to do. But the Shortcast, on the other hand, is about helping NGOs in a very different way. Because here what we're going to do is we're going to talk about the nonprofits themselves. We want to talk about the work that they do, the cause that they represent, what is the torch that they're really carrying, right? And why should the world care about it? Yeah, that's what the Shortcast is all about. And for our first ever Shortcast, we have with us Dr. Apte, Dr. Kalpana Apte, who is the Director General of Family Planning Association of India. And she's a 30-year veteran in the space of family planning and sexual and reproductive health. Welcome, Dr. Apte. It is such a pleasure to have you here.
Thank you, Vardha. It's a pleasure for me to be on this Shortcast.
I am so happy to have you here and talk about the work that FPAI does. I do know your work fairly well, but what we're going to talk about today is something very different, very unique, and something I don't know all that well. And it's really about the work that you're doing in cervical cancer. And honestly, I was surprised personally about it because I know FPAI, FPAIndia, and I know the work that you do in family planning in the space of contraception and things like that. But cervical cancer, why is Family Planning Association of India working in cervical cancer?
Well, Vardha, you know that we are a 75-year-old organization. We hit 75 this year. And we have reinvented ourselves according to the community needs and the trends in health or ill health around sexual and reproductive health and rights. We work in 18 states. It is something, if not us, if not FPAIndia, I don't think that to scale that it requires to be done can be initiated and taken over by any other initiative in that sense. So we provide a full spectrum of services, awareness and skill development to a whole lot of different kinds of community groups, women, men, people with full diversity of genders, young people, everybody. So it's a life continuum kind of approach that we have. And therefore, if you see, cervical cancer is one of the most neglected cancers in the reproductive health of women. And that's the only cancer that is entirely prevented just by giving one vaccine before the woman is sexually active or immediately within the early years of sexual debut. And therefore, it's a pity that any single person has to die from cervical cancer.
This is a little bit of a new one. Okay, I'm well familiar with public health. It's been a part of the work that I have been doing since 2010. And we have always been told that cancer is a non-communicable disease. So how is a vaccination going to prevent cancer?
So, Vardha, this is very interesting. You are absolutely right. Most cancers are non-communicable, but this cancer, cervical cancer, and some forms of other reproductive cancers in men too, are actually the only cancers which are caused by human papilloma virus, HPV. And since it's a virus, yes, which is sexually transmitted, vaccination before the woman or the girl becomes sexually active really helps the cancer not to develop. Now, there are multiple strains of this virus. You heard of COVID, the virus.
Multiple Delta variant.
There are many strains. Similar to that, out of those multiple strains that this virus has, HPV, few of them are known to cause cervical cancer. So if you vaccinate against those 4 or 5 most prevalent strains, the likelihood of getting a cervical cancer really reduces up to 90% or even 100% in some cases. And therefore, I say that this is an entirely preventable cancer because it's very peculiar. As we call etiology in medical terms, the genesis or the progression of the disease is very peculiar. The infection remains in the body dormant for a very long time. And then after decades even, it can cause cancer. And it starts again, the changes in the body or the changes in the cervical mucosa starts showing up early, still not cancerous, and even if it is screened in time and treated, it will not develop as cancerous lesion.
Okay.
So, really speaking, this disease is so unfortunate that this disease is something that can be arrested, either prevented completely or treated, arrested at multiple points of time in a woman's life.
And as they say, I mean, first of all, the words that come to my mind are, sorry, very non-medical. But what a sneaky, evil little thing, right?
It is.
And
It is.
as they say, it is a very smart virus. It sounds like that. So they say Ebola is not smart because
No.
you get it and you're dead. Right?
Yes.
There's a very short window.
Yes.
And once the host is dead, it can't transmit. But this
Absolutely.
is lying in wait for years.
Absolutely.
And then in the meanwhile, it is spreading. Is that how? Is that
That
what's
is how it
happening?
is. That's why it's very, very unfortunate that women have to die because of cervical cancer. So that's why when you sum total in public health speak, if you translate the medical facts into how the genesis happens, it is really speaking a disease of ignorance and inequality.
Okay. Say more. What do you mean by that? Ignorance and inequality. Okay.
So, see, in India, cervical cancer is the second highest cancer causing deaths amongst women.
Really?
Really. Second highest cancer causing death amongst women, which is a pity that it is entirely preventable. Now, any cancer, including this one, doesn't really look at the socio-economic strata of the woman.
Correct.
Poor, rich, middle income, whatever.
Yes.
Right? Now, when I say it's a disease of ignorance and inequality, how it translates into the genesis of this disease in our country is there are so many women still in our country who are not able to go for a routine checkup, medical checkup.
Correct. Either too poor or living in some
Remote areas.
far-flung area. Yes. Yes.
Yes. And more than that, their lives are not really important enough to be taken for regular checkups.
Sad but true.
That's the truth. That is the gender gap. That's the gender inequality in our country, and that's the inequality. That women's health is not understood to be important enough that if you are asymptomatic, you still need to have regular checkups.
Okay.
But how many women are able to understand that, get that information, then mobilize themselves or their family cares for them that they go and get it tested, regularly screening.
If nothing is visibly wrong, हमारा क्या problem ही क्या है? सब सही तो है, right? That is how it will be. And if especially in the lower socioeconomic strata, if she even thinks of doing it, probably will be discouraged.
Yes. And then, of course, let me come to ignorance. Now, ignorance is something that's very tragic. Because even if you had the money, even if you were an empowered person about your own health, someone who has money, someone who's coming out of the house, who can go to a doctor, doesn't know that this is such a killer disease.
Absolutely. I didn't know. If I knew this, I would talk to my nieces, I would talk to my cousins. We don't know what causes cancer. Fact of the matter, we can hypothesize, we can statistically talk about things, but this is something we know what causes it. We know what stops it.
Yes.
But not enough people know about it, which is tragic.
Yes. So therefore, it is ignorance about what causes a cervical cancer, how you can diagnose it if you get regularly checked up, how it is really treatable in very early, because it takes, once the lesions start, 8 to 10 years, also even in some cases at least 5 years, that it sits and then it gives you a long time, really.
Okay, yeah.
And the third thing within this also is the stigma around getting examined. Women feeling kya karna hai, why unnecessary, that whole thing that we feel a little bit about the reproductive and sexual health are not really very well accepted or very normalized words, if I can say so. Sexual and reproductive as a concept and words are not normalized. Maternal health is normalized because there is a progeny.
Yes.
But the health of the woman herself, particularly reproductive health and sexual health, and this stands at the juxtaposition of these two verticals.
Absolutely. Dr. Apte, let's double click on this for a second, okay? Let me ask you a question. Now, because of this, the fact that it is a sexually transmitted virus, okay, the perception is already stigmatized. Okay.
Yes.
If I talk to somebody and I say, hey, you should do this, you should get this vaccination. If I talk to, let's say, my cousin who has a daughter, right, and say that you should get your daughter vaccinated, the automatic implication there is that are you suggesting that my daughter is going to be sexually promiscuous?
No.
She's not going to be sexually promiscuous.
No.
Why should she get vaccinated? No, the mind thinks like that. So how do we have this conversation?
See, I think we need to understand that it is not about my daughter's behavior. It's not about my behavior. It's about the prevalent infection in the society out there. It's not about the behavior really. It's about the probability of a partner who might be a carrier, who might be a non-symptomatic carrier. So it's about
Makes sense.
protection. Nobody can ask that, am I really going to drive rashly when there is an airbag in the car? It's not because the driver is going to be a very rash driver. It's also that there are certain situations, accidents do happen, and
Yes.
we need to protect ourselves. I think it's extremely important that we should not self-blame or stigmatize it.
Correct. So, very good point, Dr. Apte. I'd like to underline that one. So, it is not about promiscuity, it is about protection.
Yes.
Even a very normal, safe, practicing very safe relationship is vulnerable.
Yes.
So, we have to protect, is the message I'm taking away from this.
Absolutely. I think we need to move away. For health-related issues, we need to move away from morality, blame, and, holier than thou attitudes. We need to be pragmatic. We need to understand that in which society, which day and age we are living. And we need to see that everybody gets that message and we protect our children. There are countries where the governments have made this as a policy that all young girls will be vaccinated.
Really?
Yeah. There are many countries where this is a law. It's about protecting.
Wow, that makes so much sense. So, Dr. Apte, that I think was really enlightening. What I'd also like to understand is, so what are you doing about this? What is FPA India doing to solve for this?
So we have now strategically taken a decision to scale up the entire intervention around cervical cancer. We wish that in coming years we make a significant dent in this infection turning into cancerous lesions. We would like to reduce the disability and deaths related to this cancer. We would like people to be aware about it. We would like women and girls to be vaccinated. We would really like everybody to understand how important it is to prevent this and to regularly screen. And we would really like a very wide awareness around this. We want to seek funding to improve all these interventions. Already the government of India has prioritized that and they are doing a lot. But India is a huge country and we all need to work together. The government reaches to almost everybody, but still there are areas, communities which we can reach out to help to see that public health initiatives are stronger. And we seek funding for doing that. We seek funding to reach out to the most vulnerable and most far-flung areas. And this is why we are starting this campaign with the Tata Mumbai Marathon, in which our cause is a race to erase the cervical cancer. And beyond Tata Mumbai Marathon, which concludes in January, we will continue working on it in 18 states of India. Through our direct interventions, we seek partnerships from allies, like-minded organizations, people, interns, volunteers, to make it a part of their work and see that we really step up awareness around this and also change behaviors.
I don't think it is possible to articulate a more holistic approach in the 60 seconds that you have. Also, if you could tell, so what are the specific actions, interventions that FPAI is doing in this space to combat cervical cancer?
So, Vardha, basically, we are going to get into a three-pronged approach. One is awareness. And awareness could be of various types: social media, using many platforms, group meetings, one-on-one meetings. Particularly the key group is at this point of time young people. So comprehensive sexuality education is something that we've been doing for decades. And using that opportunity, because every year we reach out to 3 to 4 lakhs young people below the age of 25, working with them to impart
That's
a
a huge number.
That's a huge number. Yes, it is. And most of them are from the government schools and local municipal schools and colleges. So, working with those young people, peer educators, to include this topic as a very important information to young people and the availability. I'm very happy to tell you that there is an Indian vaccine now available. Government of India is thinking of rolling it out. So that kind of key information, that when the Government of India does roll it out, then the young people who are in schools will accept it wholeheartedly, and there is an acceptance of the program. So that kind of information reaching out to the people. The second thing is service delivery. Service delivery again has some sub prongs. Is the vaccines. Vaccine. We just did a huge initial program in Bangalore where we vaccinated. We provided vaccines free of cost in partnership to women in Bangalore. So similar kinds of partnerships with different corporates, say Rotary and other institutions, to see that we can reach these vaccines to young people and women early, so that it can be helpful. Again, the second sub prong of the service delivery would be to screen women, treat them if there are initial early lesions are found, cervical changes, or if we are not able to provide that kind of service, then to see that they are referred to an appropriate partner institution where they can be provided proper services in time, so that we don't lose them or the disability doesn't happen. So that is the second part. And the third one is partnerships. We are a large organization with footprints in 18 states. We reach out to 1 crore people annually, 32 lakhs people access services, last year's data. But we still are not big enough for the whole of the country. There are a lot of like-minded organizations, foundations, corporates, media houses, community groups who we seek partnerships with them to see that this is scaled up. And we all work together to see that in our own way, we do little bit to see that not a single woman succumbs to cervical cancer in our country.
I think that's an amazing plan, strategically and also then tactically, where you're addressing awareness, you're addressing vaccination, you're addressing referrals and linkages and treatment, and then partnerships to expand to where you may not even currently be. I think that's a really, really good plan. So now, Dr. Apte, with that kind of plan, right, at a 30,000 square feet level and in the grassroots, in the gullies, also you have that covered. Tell us, if people want to support you, if organizations want to, how can people support you in this race to erase cervical cancer, as you put it?
Thank you for this question, Varda. There are multiple ways that everybody can support this. For citizens, for people who are going about their lives, they have families, you could contribute to our fundraising. Even rupees 100 matters. You could, through Tata Mumbai Marathon on United Way of Mumbai portals, you can donate on our pages. And more importantly, please share the messages that we post on our social media. Please follow us. Share the messages around cervical cancer on your own social media. Join our mission to save India's daughters and mothers. See that there is not a single death happens. Talk to people who are around you, women who are around you in your offices, your colleagues, and in your trains if you are traveling, in your carpools, in your kitty groups, or in any group that you are talk about this issue. Popularize it and also support, of course, even 100 rupees matters. Then the second group could be of people who are women themselves, women leaders. Please do record 1 minute video talking about cervical cancer. What would you like to speak about it? What is something that really struck you? Is there a life story out there? Is there something that resonates with you? A 1 minute video, share it on your social media and tag us. I promise that we will like, comment, and reshare. Let's really save lives together, and let's see that your voice reaches thousands and lakhs of other women and people who can hear your very inspiring words or your story or your suggestions, and it touches another life, many lives. And for corporates and institutions, if you work in health or women's empowerment, if you fund initiatives around women's empowerment, health, young people, please tell us where you are working. What is your area of interest? It's very likely that we already have a strong presence there or we have a partner there. We can help you to protect your project beneficiaries, your factory workers, your industry colleagues from this deadly cancer. So there are multiple of ways that everybody can contribute. And you know what? Together as a strong Indian community, we will be able to save our women and girls from this deadly cancer.
I think that's a very, very powerful message, Dr. Apte. Thank you for making it actionable for what even I can do, what anybody can do in their capacity, either personal or professional. And what you said is so important. I think Ice Bucket Challenge has shown us the power of one normal human being raising the awareness to share the message. I think that goes perhaps, more than what money can do. Right? If we just own the cause, share it, we can protect the lives of our loved ones. I think that is so powerful.
Varda, let's think about a teal color challenge. The color of cervical cancer, as breast cancer is pink, the cervical cancer colors, according to the internet, is teal color. So
I noticed you're wearing a teal sari today, and your bottle is also teal. Oh yes. So is your chair. My God.
this of course, bottle of course is something that serendipity made it happen. But yes, so let's have a teal color challenge. Let's all citizens who support our endeavor wear a teal color dress or an accessory and have a teal color challenge and say that you support cervical cancer elimination, race to erase, and share it on. Let's be as innovative as possible in use of teal colors.
Done. So I definitely am going to do that. I'm going to find something teal or buy something teal, and I'm going to be part of this. And I hope and pray that they are going to get behind this, and together we really are able to erase cervical cancer within our lifetime, within the decade, make a significant impact. Thank you so much for the work you're doing, Dr. Apte, you and your whole organization. I think it's really, really remarkable. And I stand educated today. I just had a mini masterclass on something I didn't know before this, and I'm so glad for being here. Thank you.
Thank you so much, Varda, for this discussion.
My pleasure. Thank you so much, Dr. Apte. Bye.